Here in New Hampshire, we're well on our way to being the fastest aging state in New England. By 2030, nearly 1/3 of our population will be over 65. Our state's Medicaid expenses are increasing as more low-income seniors move into nursing homes. Yet more than 90% of residents over 50 want to stay in their homes as they get older. 80% support shifting long-term care funding so that more goes to home and community-based services. And for the state, it's 60% more cost-effective to provide long-term care outside of a nursing home. Meanwhile, young Granite staters just beginning their adult lives face a different challenge. With New Hampshire consistently ranking at or near the bottom in higher ed funding per capita, student debt for college grads in 2015 averaged just over $36,000. It's the highest in the country. As a result, nearly 60% of college-bound high school seniors decided to leave the state altogether, making us the #1 exporter of four-year college students. Once they leave, most of these young people are gone for good, making workforce development a top concern of business leaders and policymakers alike. Pair these two challenges with an innovative funding mechanism, and we have an exciting opportunity to positively impact the lives of New Hampshire residents, both young and old, while decreasing the cost to taxpayers. Granite Service Scholars is a proposed AmeriCorps program helping organizations providing non-healthcare services to build capacity so that more low-income seniors have the opportunity to live in their own homes longer while driving down state Medicaid costs. Granite Service Scholars recruit civic and faith-based groups, schools, businesses, everyday citizens to volunteer to help their elderly neighbors by providing transportation, meals, home maintenance and repair, social and recreational activities, and more. In return for 2 full-time service years, Granite Service Scholars receive an education award equal to 4 years of in-state tuition valid at any public or private college in the state. So how do we pay for it? By creating a social impact bond, or pay for success financing. Instead of paying up front, social impact bonds allow government to focus on approaches that work, without paying a dime if agreed upon outcomes aren't achieved. That means if an independent evaluator determines that Medicaid costs didn't decrease as dramatically as was originally agreed upon by all parties, then the state isn't on the hook. Learn more at graniteservicescholars.org. We have the opportunity to address a handful of our state's most pressing challenges through public service and innovative financing. When young leaders invest in our seniors, we'll invest in their education and our collective future while decreasing the cost to taxpayers. Granite Service Scholars is a win-win-win for New Hampshire.